We are proud to present our new publication in Mayo Clinic Proceedings on diagnosis and management of myalgic encephalomyelitis chronic fatigue syndrome, also known as ME/CFS. I'm Jamie Seltzer, and I'm the Director of Scientific and Medical Outreach at ME Action and a researcher with Stanford School of Medicine.
Hi, I'm Dr. Stephanie Greach, Assistant Professor of Medicine in the Division of General Internal Medicine at Mayo Clinic, Rochester. The title of our article is Diagnosis and Management of Myalgic Encephalomyelitis/Chronic Fatigue Syndrome, appearing in the October 2023 issue of Mayo Clinic Proceedings. The main takeaway from this article is that ME/CFS is not just another branch of chronic fatigue, the symptom, but a clinically distinctive, diagnosable, and manageable condition for providers of any background.
Concise clinical reviews are short articles designed to be taken in by busy professionals who want a quick but thorough overview of a disease. We cover epidemiology, disease presentation and diagnosis, physical exam, differential diagnosis, and comorbidities, what interventions are appropriate, and when to refer out. We also introduce some useful information that clinicians may not have come across before. We'll cover post-exertional malaise, the pathognomonic symptom in depth. We'll discuss emergency care for severe presenting patients, and we'll touch on pediatrics as well. I hope readers will find our original diagrams useful and shareable, an educational tool in their own right. Our CME is case-based. The CME was a great opportunity to go into greater depth, relating some of the most common patterns of signs, symptoms, and comorbidities our readers will encounter in a clinical setting. We feel it's great to learn new information and put that into practice right away, and an associated CME allows clinicians to do just that.
Mayo's 2030 vision is to cure, connect, and transform in the most complex areas of medicine, and we're now in a unique position to change healthcare for ME/CFS. Our paper highlights several areas in the field that are perfect for progress in line with this mission. For example, how do we as an institution improve accessible clinical care for the 25% of people with ME who are housebound or bedbound? How do we use wearables or otherwise deliver research opportunities directly to the patient so we can avoid the risk of PEM that comes with travel? Tackling these issues requires collaboration with the right team, which often means going beyond the clinic walls. From the start of our efforts to reinvent the clinical, research, and educational approach to ME/CFS here at Mayo, we have partnered with the healthcare advocacy organization ME Action to ensure that our work is informed by those with lived experience. With the input of our co-author, Director Seltzer in particular, who is a subject matter expert also with lived experience, we're able to focus on work like this that both aligns with Mayo Clinic values and directly results in meaningful outcomes for our patients.
Millions of people are developing infection-associated chronic illnesses like ME/CFS in the wake of SARS-CoV-2. It has been estimated that about half of people presenting with long COVID at 6 months have ME/CFS. Given that this population is growing and unfortunately will continue to grow, it's vital that medical providers of all stripes learn more about how to recognize and address this disease. It's not about giving people with ME something as ephemeral as hope, but about real-world solutions skilled, empathetic providers can create in partnership with their patients. And to people living with ME, that means the world.
Our concise review helps clinical practitioners identify ME/CFS. This can include primary care providers, specialists, and sometimes physical therapists who may actually be the first to identify that pathognomonic post-exertional malaise. Identification is half the battle, since it can often take 5 or more years for patients to get the diagnosis. Once diagnosed, providers can use the tools we discuss, from pacing as a base activity management strategy for all people with ME/CFS to different medications to support the various symptoms of their specific patients. This not only improves patient outcomes, but supports positive, collaborative patient-provider relationships.
Infection-associated chronic illness is an up-and-coming area of research where there is a real opportunity for pioneers. And all researchers interested in long COVID should be familiarizing themselves with the infection-associated chronic illness literature, including that of ME/CFS, POTS, and MCAS, since a significant percentage of people with long COVID will have these diagnostic labels. Recruiting patients with a diagnosis of ME/CFS for studies can be challenging if clinicians don't feel confident diagnosing the disease. By familiarizing clinicians with the diagnostic criteria and positive signs, we can help ensure more people living with ME can participate in and benefit from clinical research. Finally, through our discussion of fundamental features of disease presentation like PEM, we may point researchers to fruitful investigations into the pathophysiology of the disease.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.